Hi, my name is Kevin Suarez. I'm going to be doing my palpation video. I'm going to start off by first doing a 360 around the room. Okay, here I have my scenario. It doesn't have anything on it. Both sides. The only paper that I'll be using today. We have my patient here. We'll be performing the serratus anterior, the infraspinatus muscle, and the extensor pollicis longus, as well as checking for the coracoid process of the scapula, lateral epicondyle of the humerus, radial styloid, and the medial epicondylitis test. So first we'll start off by doing the bony landmarks. So if you can lay on your back for me, please. The first one that we're going to be looking at today is going to be the coracoid process. We're going to be looking at the coracoid process. So we're going to start by identifying that the sternum or the clavicle, whichever one we can start at today, we'll start a little further down, come superior from the sternum to get to the jugular notch right here. Superior, come lateral down the clavicle here, and we're just before we get to, we're going to get to the acromion process over here, but just before we get to that, we're going to find a space into this tissue, and we're going to find the coracoid process of the scapula, and we'll do a round turn over it to make sure that we're on the process. Okay, next we'll come back. So that was lateral, and then we came medial from the acromion, and inferior from the clavicle. Next we're going to go superior and follow the ridge of the acromion process down the humerus to the greater tubercle. And so next we're going to come down the humeral shaft, humeral body, and the next thing that landmark past the deltoid tuberosity, and we're going to come down to our next landmark, which is going to be the lateral epicondyle of the humerus. And if the patient could let their arm down, just relax your arm, please. And so I can palpate that. Coming down once again, inferior, coming down inferior, down the shaft, staying on the lateral side, down to the lateral epicondyle of the humerus. Okay, and the same process. We're gonna come down, down even further to find our next bony prominence, and that's going to be the radial styloid process. The way we're going to get down to there is going to be coming downward or inferior to the lateral epicondyle, following the radius bone, passing the head and the neck, past the shaft of the radius, and coming down all the way to the radiostyloid process, which is this bony prominence right down here. Okay, and we know it's on the radial, this is the radial styloid for the radial side of the thumb. Okay, and so so those are bony landmarks, and once again we came inferior and stayed on the lateral side. So the next thing that we're going to do is find the serratus anterior. So if I can reposition. So the next thing that we're going to do for this muscle is we're going to identify the pectoralis major. And so if we can bring our arm, if we have the patient bring our arm closer, so bring your arm forward and inward. Can you flex for me and give me a strain? Okay, I just want to make sure I know feel where that pectoralis major is. Okay, hold on, relax for me. All right, so now that I've identified the boundaries of the pectoralis major, I'm just gonna find it down in between the pectoralis major and the posterior side is the latissimus dorsi. In between that, right here, is going to be the serratus anterior. You know that where it is when it comes from the ribs. It's muscle that is superficial from on top of the rib. And so the next thing that I'm gonna ask the patient to do, now that I have that palpation, that muscle palpated, I'm gonna have the patient lift their arm up to the ceiling, okay? Closed fist. And I'm gonna ask the patient to press against my hand, and feel that muscle work, okay? And we'll try it in different ankles. Yep, and relax. And one more time. Yep, and one more time. Okay, yep, and so now I feel this, it's just over the rib cage, and I feel it firing. Right there. Okay, and then so the next one that we're going to be performing is going to be the infraspinatus. So if I can have the patient lift up, and can you lay on your stomach for me, please? Okay, and so one thing that I'll have the patient do is I'm going to have him lay his arm just over the side here for me. And so as that hangs off, we're going to identify the markers of the infraspinatus. The infraspinatus runs along the medial border of the scapula. And so if I palpate just enough, find the hard surfaces of the medial border. And we're also going to be looking at the greater trochanter. So in between this triangle, this border and the lateral border of the spine of the scapula, we'll find the infraspinatus. The infraspinatus, the way we're going to fire the infraspinatus is I'm going to have the patient move their arm. I'm going to have the patient move their arm posterior. I'll instruct the patient as I palpate the muscle. I'll have the patient, oh, sorry about that. I'll correct myself. The infraspinatus performs external rotation. So what we're gonna do is have the patient turn their lower arm, their hand, towards the wall. So that means going forward as I press against them. Okay, and relax. And I'll just hold for resistance. One more time. Yep, and I feel that fire. And I'll run, and the muscles will run along here. Okay, relax. Okay, and one more time. And I'll feel in just a different position to make sure I'm in the right area. Okay, and just relax. All right, so next thing, the last one that we'll have done is going to be the extensor pollicis longus. So if I'll have the patients sit down for me. Okay, and if you can turn straight, turn over this way. Yep. And so the next thing that we're going to do is, I can get a little closer. We're going to do the extensor pollicis longus. So the extensor pollicis longus is going to run on the back hand, the back of the forearm, run forward, but the belly will be just about right here, and tendon will run just alongside to the distal side of the distal posterior side or dorsal side of the hand. The way that we're going to find that is we're going to have the patient can you lift your thumb upwards for me against my fingers? Okay, and the first thing that we're gonna find is that pops up is the tendon of the longus, the extensor pollicis longus, and then depending, and we know that we're on that, we'll palpate that, and palpate as well, relax, and catch the muscles fire in the belly. If you can press against my fingers one more time upward, yep, perfect. And so we know that this is gonna be the longest. You can relax. We know that this is going to be the longest because as we fire, we can see the most posterior, the most upper or more dorsal tendon protrudes. That's the longest. Also, if we can put one more time upward, we'll see down here is the brevis. So that's how we could tell the differentiation of that. So those are that's the last of that. We're palpating on skin with all the palpations. The last thing that we're going to be performing here is the special test. And so the special test is going to be performed, you can stand up for me. What I'm going to have you do is, if you come forward, back here a little bit, get a little bit of space for camera. What we're going to do here is I'm going to palpate with either side. If I can get a palpation, gonna come on this side for me firstly. If I can palpate the middle, the medial epicondyle, and I'm gonna have the patient put their arm in a slightly flexed position. I'm gonna put the patient's hand into an extension. So what I'll instruct the patient to do is lift your arm, lift your elbow just a little bit, and put just your elbow. Lift it up a little bit to get in position, and then as well point your fingers downward and your wrist downward. And as I apply pressure, I'll hold the palpation of the medial epicondyle, and I'm testing for medial epicondylitis. So what I'll do is, if you can relax, I'm going to passively go through this. Let me know if you feel any symptoms or any pain coming from the inner part of your elbow here, where I'm holding. And I'll hold down, and if you can relax, I'll just press down on it. No pain?
No pain.
Okay. Thank you. And we'll try one more time. And we'll extend the elbow. Perfect. Okay, and that would be my last test. Last things that we've covered were lateral epicondyle. We covered the coracoid process. We covered the radial styloid process. Performed muscles of the sartorius anterior. We performed a test on the infraspinatus, the extensor pollicis longus, and performed a medial epicondylitis test. I'm looking for medial epicondyle pain. Okay, thank you so much. Have a great day.